And we're on now to our last flash presentation of the day. You would think I planned it to go from consumption to wastewater surveillance back to back, but in any case, our last flash presentation will be Cresten Mansfeldt, who's an assistant professor at the University of Colorado Boulder in civil, environmental, and architectural engineering and the Department of Environmental Engineering program. The research spans environmental contaminants, microbiomes, and more. And as I mentioned already today, we'll be talking about wastewater surveillance. Thank you.
Well, thank you, Matt, for the both invitation and introduction there. And also thank you, Janine, for setting up where you didn't go into the toilet, but now we will actually go into the toilet, go down and through it, because you get a lot of information out of it. I realize with the title of this talk, it's much more talking on how everyone here is not a bystander. You're actually a participant in these different types of surveillance structures. So you're moving into actually providing a biospecimen that goes from your toilet, often about a 10-mile trek to the wastewater treatment plant. So it becomes a different conversation that I probably should have retitled this to the audience to say, it's easier to lie to your doctor than to the sewer, because of the fact that when we zoom into the sewers themselves, they are this pretty much just a river stream that exists underneath our urban environments.
One more. Keep going. I'm taking a video.
I was just telling my student right there that I'm taking a video because that was right outside of our own building right there. And you could start zooming in on the surveillance network and think right at the toilet, you have a pretty specific indicator. Maybe one household, one person per toilet. But if you go up to a wastewater treatment plant, now you're looking at entire community health. What is the public doing? What is the prevalence of a certain pharmaceutical intake, of a certain actual respiratory disease or virus that's moving through? So you have a wide operation where you could also look at in the network itself. You go out to a neighborhood street or right outside of somebody's house right there. So you can see that there's a lot of ethical questions that arrive very quickly of how disruptive some of this technology is and how much a community might accept having surveillance move in. So what we're going to walk through today is just kind of a personal context. We'll go through what we set up at CU Boulder about 5 years ago now, and actually think about some of the actual ethical operations of how these systems are being set up both within the United States and globally. So this is the sketch of what we were doing on campus. Right when the SARS-CoV-2 pandemic broke out, we tried to bring as much resources as having as much information of how the virus was prevalent on campus and potentially move. So at 23 sites, primarily targeting the residential dorms, we set up automatic samplers that would just take small amount of samples over 24 hours. We had a team of undergraduates who would go out, pick up the sample, and then we would actually analyze it within the laboratory, returning within about 4 to 6 hours after the sample pickup, the actual concentration of the SARS-CoV-2 within the waste stream. We report the data back, combine it with all of the other surveillance indicators out there, and to make informed decisions about if we want to keep the campus open, if there has to be more testing in a certain area, and actually allowed a much more cohesive portfolio of action items. What this actually looked like is each one of the red dots there is overlaid onto a map of CU Boulder's campus. During this supply chain disruption, we didn't have access to commercial samplers, so our team, being a whole bunch of engineers, whipped together about $500 unit samplers right there. So you'd see these black boxes, primarily withdrawing slowly over that entire time period, a little bit of a waste that's coming from those rivers that were down below. They would go pick up the samples and then be able to quantify. So the results came in, and this is just from the spring survey. We were monitoring for both the fall and the spring. And as you can see, the dark blue, as it's getting darker, is indicating more of the sample is returning, so more of the SARS-CoV-2 is being detected. Those bar charts down below is actually comparing two things. First, we were tracking the envelope, so that actual signal for the little bit of mRNA that's encoding that for the virus itself. We were actually tracking both in fall and spring, and you see in the red bars, we did have a major surge that went through campus in the fall. What's the second bar graph over there is actually indicating our healthcare data. So that's actually the number of cases that were detected at Wardenburg, our healthcare center. And you can see, even without any statistical correlation, that everything seems to be overlapping quite a bit. So this was also early on in a lot of investigations as wastewater surveillance was gaining widespread across the globe. And so this was also demonstrating that, yes, human activity is consistently showing up within our waste streams themselves. It's not just viral particles, though. So if we move into the bacterial realm, we can start learning information about other emergent public health crises. In this case, what we're looking at is some of the antibiotic resistance genes and actually tracking both the different heterogeneity of some of those different components, so all the different types that we're actually detecting within the wastewater, and then any fluctuations that were happening at each one of these different sites that were happening. It was consistently detected, and then this is also now getting into that idea of, well, what do we do with the information? How does this actually inform actionable distribution and interactions with the waste streams? So this was starting to really increase that idea of the question. What are we doing? For about 25 bucks, I don't necessarily recommend this. You can order a sewer hook online. I don't think anybody's taken me up on it. It started a hobby of just opening some of the manholes around either cities or your campus there. But there's a huge amount of information that's moving below us. It's not just viral, it's not just bacterial, but it's also all the small molecules that we're either experiencing from exposure, so all of the hazardous wastes, all of the air particles that we inhale and go into our bloodstream, but also additionally, all of the interventions. So all of the pharmaceuticals, all of the different nutrition additives, illicit substances, artificial sweeteners, as well as even caffeine is showing up within our waste networks. So as this technology gained, where we were basically reinterpreting something that exists in our urban centers for a very long time, so in Denver since the 1880s on, how do we actually consider the ethical ramifications of it? So during the same time that they started to have these expansions of the campaigns, there was a lot of retrospective studies that were emerging. Two that are pulled out right here was just looking at the policy and practice. How can you actually get this into implementation? The other is basically saying, well, how do you actually implement it? If you're a wastewater treatment plant, how do you actually turn some of these systems online? Community, though, had a lot of care and consideration early on. As environmental engineers, we realized that this was a new usage of a stream that people often forget about, that you're continuously going to actually participate with this and on a daily basis. So we tend to be very conservative when adopting new technologies or approaches. Because one of the first opinion pieces that came out back in about 2021 right there was basically saying, any type of application that you're doing, you're gaining a lot of information on the population that's connected to it. And often the population is unaware of that signal that's occurring. And this other much more in-depth analysis also highlights the fact that wastewater data is a little bit unique. Because it's collected from an infrastructure system that is often publicly owned. So it becomes also a data provenance. Who owns the data and how do you actually protect it and ensure that those that are benefiting from it are benefiting in an equal manner? So this is where we were able to assemble an early team. I blurred out every participant there, but they were a very huge contribution to it, where we started to say, how do we actually frame a system to analyze these different types of surveillance networks that are being set up? What we did was we scraped all of the publications that emerged between 2020 and 2022 and just said, hey, if we were applying a systematic framework, is something being reported in this paper that would raise an alarm? Is it something that we should have a little bit more review on either how we're communicating it or how something was conducted? As we look through all of these different data sets, what we're finding is wastewater systems are pretty broadly applied. So there wasn't as much of an issue for what was actually being detected there. Areas that we were actually struggling with finding enough to quantify were actually on some of the data stewardship and protection. Who is maintaining this information? Who is actually overseeing it and protecting it, ensuring that it's being used in a proper and appropriate manner? And so if you have any interest, this is actually something that's been published out there, and it actually goes through and applies two different frameworks. One much more on just surveillance ethics, and the other using the public health framework for any of the data that's being gathered. One other thing to really consider is, although our waste infrastructure is pretty comprehensive, it is not universal. And there is other historical ethical implications that exist with access to toilets. Everything from race, economics, and gender expression have been utilized to exclude people from our sewer network. And so this becomes a consideration of when we are thinking about access or exclusion from our surveillance structures, who actually is providing sample and benefit from the data that's being collected. And so this is a huge area that we've started to move into because there is the primary objective that we've set up our waste infrastructure around of sanitation. If we didn't have sewers, we'd have some of our classic diseases returning, such as cholera, typhoid. And so there is a substantial public health benefit for maintaining a social construct of flushing a toilet. But there is also this aspect of multiple other types of resources that are emerging. Everything from the information that can be used for much more of a public health benefit to some of the waters itself that is now being recaptured in direct potable resources as well as indirect potable resources. And also all of the products, everything from the nutrients, so all of the nitrogen and phosphorus that's going down the drain, as well as pharmaceutical recapture, potentially metal recapture. And so there's a lot of interest to balance all of these different stakeholders within a specific community. So I have one PhD student who's really looking at this and finding how to structure some of the conversations around reducing the toxicological impact, reusing the wastewater, and providing the information to multiple types of interested parties. And this becomes the aspect where context for our wastewater surveillance is key. It's not going to say that there's any red line that you're not going to cross. There's been very successful illicit substance monitoring campaigns, such as set up in Arizona, that were community driven. And so since it's a community resource, it's much more how do you partner and actually inform that community to make the best choices for their own valuable waste stream. And there is a much more broader concept that was brought forward in a wastewater cookbook, which I'm still always surprised that they got that naming through kind of the World Health Organization there. And it's one in which it says there's guidelines for this. How do you partner and ensure that the system is benefiting from any action that's being taken? And additionally, our team then launched in this past year to go through a series of wastewater workshops where we're trying to understand how to develop the materials and resources so that those that are more of on the technical side can partner with those on the social and community organization side to ensure these things are long-lasting and beneficial to those who actually are falling underneath the surveillance purview. So some of the identified themes from that workshop itself was basically saying, how do we get lines of cooperation from sometimes areas that are very resistant to cooperating? So there is beneficial information for law enforcement within our wastewater, definitely for research communities, definitely for the public health, and also for private industry. How do we ensure that there is open access for something that is a pretty open access resource that's out there? And that's also how do we define who has access at what locations? It's different context if somebody's monitoring right outside somebody's household versus if you're at the wastewater treatment plant. So where do you cross from that private to public threshold? And then how do you communicate that data back? At the national level, the CDC has a wastewater surveillance dashboard, kind of a clearinghouse of everything that's been collected for SARS-CoV-2, for influenza, RSV, and a suite of other pathogens. But what is actually done with the data? Who's interpreting it and crossing it into something that is actionable? Is it the individual user that's basically going to say, hey, maybe I want to wear a mask, as if it's almost like doing a weather report and taking an umbrella? Or is it the public health agent that says we need to expand vaccines in a certain area? And that's where we actually look at how do we actually develop and engage with communities, both at the pilot scale, so prior to these things up and running, but then also at the long term. It's not necessarily the community will continue to agree to surveillance. So how do you continuously address and incorporate concerns within these systems? And that's really the balance of the toilet. There's a lot of risk for actually keeping people maintained in something that is socially conditioned at the toddler level, to actually then being able to benefit from the substantial amount of information and interventions that you can actually get back out of your own toilet right there. And with that, this is a huge amount of effort that's gone into many different aspects of the collection, as well as the access to the different sites, and then to the actual interpretation of the ethical guidance. So I thank you for your time today, and I entertain any questions.
Okay. I was wondering how, you said that different populations can be, limited in their access in so many ways. So for these different communities, when you're doing the different projects, are you testing the water? You talking about the cookbook, for recycled water. Do you have different ways to test for different populations? And are you taking that back to the populations?
One population that we did work with directly was the unhoused population, and really trying to understand both their access to sanitation structure and what benefits they potentially could get out of surveillance. We were surprised very early on how some of the advocate agencies as well as individuals were very excited by it, because often they are limited from other types of screening methodology and additionally don't have access to continuous clinical care. So they were very supportive of the screening for any of the communicable diseases. But there was also a substantial apprehension around any illicit substance monitoring. And that was because there's been historical precedents of exclusion from sanitation networks where if, like at a bus terminal, they close access to toilets because there was drug use activity detected at some point.
Yeah.
So naturally, that was where to see the public health agents being able to change their communication of saying, we're only screening for the communicable diseases for this specific benefit to the community. And we won't have the same agreement for any of the small molecule monitoring. That would require a different re-engagement with the community. So I think that becomes where we have so many tools and techniques to monitor everything that's coming through the waste, to renegotiate that for any time you're switching major categories.
Great, thank you.
Yeah, I was fascinated by the example you gave of an illicit substance monitoring program. I think you said in Arizona that you feel is well done. I'm curious how especially in light of your comments just now about the homeless population, when you talk about community engagement, which community, assessed that this was well done? I would guess it's easier to get agreement among people who are not using illicit substances that, yes, we ought to be doing illicit substance monitoring. And if you were able to get a hold of the folks who are using illicit substances, they might be less inclined. So how do you sort of use democratic deliberative engagement when you're talking about something that's kind of inherently problematic in the sense that the larger community really looks, stigmatizing, looks down on this behavior, but there's a smaller minority that, fears this. How do their perspectives get weighed?
And I think that's one where it required a lot of care and communication and establishment of the surveillance network itself. So it was, I think, a 1.5 year long process. And one of the things that early on, it wasn't a surveillance that kind of tripped where it was a recognition of public health crisis. It was something that was already being communicated both from the local hospitals and the public health department that this is actually a crisis for this community that's experiencing it. That kind of removed a little bit of a layer of the stigma of a discovery of a crisis. So then it was introduced as a tool, not for a police intervention, but much more for a public health service where it could be bringing different treatment resources or other advocacy campaigns, or even screening of the drugs that were within the community to ensure that some of the synthetic opioids weren't contaminating the main opioid screen. And so that's where it allowed different resources to be applied to really also put down the mortality rate, but then also address the morbidity rate where it was actually getting people direct resources. So by having that as what was the opening conversation, it switched it from a more of a criminality type aspect conversation.
How specific can you get with this surveillance? What level of detail can you this?
So there was one example where a researcher went up all the way to a single toilet for a cryptic strain of SARS-CoV-2, trying to figure out why there was this odd mutant form in a specific community. And that's pretty much more of where the limitation exists, is the subdividing of your pipe network. because it's pretty much just mixing biospecimens all the way down. And it also depends on what you're screening in, how far back you have to go to detect individuality within the specimen. Because of the fact that with advancements in full human genome sequencing, you could actually change your lens and start finding that kind of information within it. So there's also been publishing agreements where any of the human data has been masked from any of the metagenomics that have been being posted.
And then when in the pipe does it become private?
That it's a very controversial question because it's one in which there is Supreme Court precedence along the solid waste infrastructure that if you put like your trash can to the curb, you actually no longer have an expectation of privacy over it. And you could also see that this would switch from, if you're going from an American to a Canadian to a European concept. So community to community and also the type of engineered infrastructure might change the expectation around privacy.
Any last questions before we move to more panels? Great, thanks again.
Thank you.